we brought you some images and some stories from Bimbilla a while ago about the challenges they had with, well, of course, Bimbilla also had quite a few things, right? There was a rainfall that tore off certain parts of the maternity clinic and so on and so forth. And then later, their water got shut off for non-payment of bills and all of that. We carried the story here, and we spoke to the various leaders that are responsible for the area. But we have an update for you. Let's take a look at this report and see what happened.
Patients at the Bimbilla Government Hospital can now breathe a sigh of relief as water supply to the facility has been reconnected. Water supply to the Bimbilla Government Hospital was disconnected almost a month ago for non-payment of water bills. The bills, according to the water company, was over 230,000 Ghana cedis. Following the disruption to health delivery after the disconnection, management of the hospital threatened to close down the facility. But on Saturday, the 18th of June, water supply was restored to the facility following interventions from stakeholders. City News visited the hospital and spoke to relatives of patients who expressed happiness about the reconnection.
At first, when we come to the hospital, if there's no water, most at times we used to suffer a lot, because especially those from outside Bimbilla, those from the villages, they had to they suffer around because they had to buy water from maybe outside. And we, those from Bimbilla, we have to go to your house in order to bring water to the hospital to be able to do anything maybe that is in need of water. So at least we used to suffer a lot, but right now, alhamdulillah, because the water, they have already connected it yesterday, and I think now it's better, and we really appreciate for that.
Our sister here for delivery, and then that was today is the 3 days here. She's been here for 3 days, and then the first day that we came, there was no water, so we were bringing water from the house, and since yesterday, I think they have now connected the water. So now the water is flowing and it's helping us. Because the last time that we came, there was no water. So we were disturbed, and some of them came from village. They were not getting water here. So we were all disturbed. I think now it has been connected, so we are happy and then we are glad.
The doctor at the theater told City News they are now able to attend to cases that were hitherto referred.
In fact, when you know cases that you can help clients and you have to refer for the reason of no water, it's very sad. And most time the clients are reluctant to go. Some of them go home and come back with complications which could have been avoided. So, but for the past 3 days, everything is moving smoothly. We've been able to do all the cases that are not beyond us. And so I think it's a good news.
The nurse in charge at the labor ward was excited out of the current situation.
When the water wasn't there, most of our cases, we always refer them. We to working after conducting delivery, how to wash your hand, any procedure, it wasn't easy for us. And some of the water we even get is not clean, it's unhygienic. So it wasn't easy for us working in the ward. But for now that the water they fixed, we are happy that the work can go on smoothly. And most of our referral cases too is reduced. The elective cases, CS cases, now we will no more refer. We know that the work, we can do it well. And then our delivery too, we can also do our work well.
All right, so there's an update for you from Bimbilla. Some relief, Kokui. A relief of sorts.
Of sorts.
Yeah.
I mean, the government has a duty of care. They have a duty to provide hospitals, provide health. A part of me just thinks no hospital should be cut off for non-payments of bills. Yes, we understand GWCL needs those bills paid. But for a hospital, a government hospital that provides such an essential service, when I heard about the water being cut off, my first thought went to pregnant women, people carrying babies.
Yeah.
How unhygienic.
For both
mother and child, for the staff. When a woman gives birth, forgive me, it's early in the morning. but there's a lot of blood involved.
Yeah.
The area in which the birth is going to take place will definitely have blood stains, not
Yep.
just on the bed, on
Yep.
the floor. You know, obviously the personnel themselves, the
Yeah.
medical personnel could get blood on them. The mother herself has to be cleaned. And you ask yourself how these doctors, like the doctor who was talking in the video, how they're able to deal with this every single day when situations like this arise. And we're told time and again, even when it comes to washing our hands, that the best way to do it is under running water.
Yeah.
So here you've got people having to bring in water.
That they will fetch.
Do you understand that will be fetched? And as she said, how hygienic is it? Where's the source of that water? Is it properly treated? Like that will be coming from GWCL. So, you know, it's just a compendium of problems. And you just think, why should people who really need that kind of service be suffering like that? It doesn't make any sense to me at all. I'm glad they've been reconnected. The other story is, how do we find a way for them to be able to keep up with their bills as well? Because this is a hospital that is probably not situated in the most affluent area.
Yeah.
You know, so there's only so much people can pay for services at a government hospital. So how do we also deal with that aspect of it,
Yeah.
where Ghana Water also gets what is their due,
Yeah.
but at the same time, the hospital gets the water they need
Yeah.
to function properly as a health facility?
I don't know if there have been any conversation, I'll be surprised if they haven't, about drilling boreholes to make the hospital independent.
At least that can be clean and tested,
Yeah.
you know, to be
Yeah.
safe to use
Yeah.
in a hospital. You know, I wonder as well. I wonder as well.
So our colleague who brought us the story has joined us on the line. Alaji, good morning.
Good morning, Alaji.
How are you doing?
Alhamdulillah, I am doing well.
Wonderful. So it's good news that you brought to us about the Bimbilla Hospital.
Yes, please.
Yes. So what exactly has happened? Have they been able to pay off their debt? What arrangement has gone on for the water to have been reconnected?
Thank you very much. What actually happened was that there was a stakeholders meeting at Tamale, the regional capital, and in Bimbilla here too. Some assembly members also went to meet with the management of the water system. So in both meetings, they had a discussion. They had an agreement. What going forward, what should be done. In Tamale, what the manager of the water system told me was that they had an agreement that going forward, there are steps that will be taken for them to pay off the bill. That immediately the hospital administrator paid the current bill for this year from January to May. All the money for the current bill was paid. So that gave them the encouragement that maybe they will go by whatever agreement was that was taken at the meeting. So that was why they came to reconnect them, the facility back to the water supply. There was many people, especially patients and their relatives, they were actually suffering. They had to carry water. Bimbilla town generally had water problem.
Okay.
So and people coming outside Bimbilla had to carry water from wherever they are coming from to the hospital for treatment. The only dam serving Bimbilla is the Wampu Dam, which is the water there is very unhygienic. If you go there, mother, and they give it to you even wash your hands, you will not like it. And that is what is being served. That was what was served to the hospital for them to use. So the nurses there were also telling that no, they also feel unsafe using that water to wash their hands and things because no, the water was not good for them.
Yeah.
So in the end, the facility was connected back to the water supply, which they are happy about.
So so Mohammed, I'm curious about something. You said that Bimbilla generally has water challenges. That means that something like boreholes it would be very difficult to find water if we were to drill a borehole.
Yes, actually, the water that is served to the hospital is a borehole water. Like I told you, the Wampu water is not that good. So people normally do not use it, except those doing the commercial things. They normally buy water from that. But the water system, they have dark boreholes there, and that is the water that is being supplied to the people of Bimbilla. And it is not often that the pipe opens in town. So the hospital water that goes to the hospital, or that one is the borehole water from the management, from the water management that goes there.
Okay, so try help me to get a sense of what's going on. The borehole, how far away is the Ghana Water Company's borehole from the hospital?
It is very far. It's about 400 meters away, even more than that. It's just close. It's just the boundaries of the dam, the Wampu dam that they have dug, the borehole, and pull their distance to town.
Okay.
But the hospital surrounding is going to be a little bit challenge, because where they would have suspected to get water is where the mortuary is located, and the private people around that place have tried getting water, but they were not successful in their homes.
Okay.
And where they think that if they dig, they will get water is where the mortuary is. So people are skeptical, saying that no, if they should get water from there, what would that water be? Would that be the water from the mortuary or something? So that is the mind.
No, I wish we could have a conversation with some water engineers, because in my mind, what I'm wondering about is, why don't we, if where they've created a borehole, the Ghana Water has created a borehole, why can't they have a dedicated, borehole that supplies only the hospital? Because 400 meters is far, but it's not that far. So if they sank one just for the hospital, so that they take the pressure off, because the hospital supplies provides health services for about 65 communities, if I remember the details right.
Yeah.
Well,
you see, that is the challenge. Bimbilla, everything boils down to leadership. It's when you come to Bimbilla, seriously, it's like there's no leader in Bimbilla. Nobody cares about anything there. So the hospital actually is just left with the management. They are doing their best to serve the people. But Bimbilla town, seriously, there is no leadership in Bimbilla, and nobody cares about anything in town. So the hospital, seriously, they are doing their best.
All right, thank you very much, Mohammed Alabira. We are grateful for your contribution and the report that you brought to us, the updates. We're very much grateful for that as well. Thank you.
So when he says there's no leadership in BIM, nobody cares what's going on in town, how is that possible? When you have elected leadership, you've got appointed leadership on the local government level, but how?
Yeah, but that's where you see what you see. So
people need to sit up.
I understand it. You see where a borehole that is 400 meters away from the hospital, it's not that far.
It's like one lap around a racetrack.
It's literally a lap around the track, right? And you lay the pipes, you put pumps in place, and there's constant water. I don't know.
Is he telling me there's no assembly there's no regional health director,
this hospital
representation that can? I don't understand. I'm confused, honestly.
No, I understand your confusion because it's a confusing situation. Yeah, and it should not be.
It should not be.
For a place where the president has men on the ground, MCE, DCE, somebody's there, and then we have this going on in a hospital that supplies 65 or more communities around. I don't get it.
Crucial social amenity.
Yeah.
I don't understand this.
And clearly, the staff who are there, it's a labor of love.
Yes.
Yeah, it's a labor of love.
For them to stay there and tolerate this kind of, working
water
conditions.
has not been flowing for days and weeks.
And they still show
and
up.
they are still showing up every day to work, to do their best, carrying water from home.
Yeah. Yeah.
asking patients to bring water from home.
They're not asking for much, just water. Water to help save people's lives.
It's mind-blowing.
Yeah, it is.
How
Wow.
decrepit a lot of the leadership mentality is. Wow. You know, when people have been appointed into office, you know, and they are overseeing spaces, and they will come and lament like the people who are supposed to be providing the services are lamenting. They will also lament. Anyway, we have the medical superintendent on the line, Dr. Adams. Good morning.
Good morning.
Yes, Dr. Adams, welcome to Breakfast Daily.
Thank you very much.
Dr. Adams, so a bit of respite for you, I presume.
Yes. At least now we are a bit relieved, you know. But it was a very difficult situation for us, as you can all see. Now COVID cases is beginning to set again, you know, and you have committed health workers, okay, who are sacrificing, working under this trying moment, you know, treated this way. It was the most unfortunate situation, you know, because this COVID season, everybody's talking about infection prevention and control. It's one of the keys that you need to practice to ensure that at least COVID is controlled. And that was one of the reasons why the president found it necessary to, you know, come out with a clear policy for a brief period that water supply should be free, okay, to all households. But yet, you have people who have the guts to come and disconnect water supply to a health institution. Most unfortunate. But please thank God, it's been restored.
So let me ask you, I understand that the water supply point that is distributed to your hospital, the source is about 400 meters away from the hospital.
Yeah.
Is that right?
Yes.
Okay.
Yes.
Okay. Now, have you negotiated or discussed possibly having a dedicated line just for the hospital alone that serves no other community but just the hospital? Is that a possibility?
Yeah. Currently, we are in talk with other stakeholders, okay, to find a lasting solution to this, you know, this perennial problem. We are in talk with other stakeholders to ensure that the hospital gets a reliable water supply. Yes.
Dr. Adam, with regard to the debts that the hospital owed, what's the situation with that to the best of your knowledge? Has that debt been forgiven? And going forward, how does the hospital anticipate dealing with these water bills that seem to be quite a big burden?
You see, like I said that at the time, okay? You see, there is a public institution, okay? And Ghana Water Company is also a public institution, okay? And some time back, I think somewhere in 2016, we had letters from the Ministry of Health or from Ministry of Finance through Ministry of Health that hospitals should submit all utility bills to the headquarters in Accra for settlement to be made. This was done in August 2016. Okay, so to our surprise, the same bill that was submitted to the headquarters is the same bill that has been brought again back to the hospital to be settled. Okay, so it doesn't add up. You get my point? How can the headquarters ask for bills to be settled? Now you come back to the hospital and you are asking them to settle the same bill that has been submitted to headquarters.
The same bill from 2016?
It doesn't make sense. The hospital is not a private institution. Okay? The issues, I mean, the complications that arises as a result of disconnection, can those lives that have been lost, can it be brought back?
No.
People have lost their babies as a result of this disconnection. Okay, how are you going to? I mean, do you think you should be forgiven? It's most unfortunate. Okay, it's very, very unfortunate. That's why I said that. I mean, people should be held responsible. Okay, for all this action that is going on. If your wife is in labor, the baby is not breathing well. Okay, the baby is in distress. There's no water for you to get the surgery done to save the baby. As a result, you have to refer. And the nearest referring facility from Bimbilla is about an hour drive. Okay, how sure are you that when the patient gets there, the people there will work fast to get the patient into theater, work, and safety safety? Okay, so these are the issues the way you are doing is not the way to get the problem addressed. Okay? Let's see how we can help each other to address this situation. But if you continue to come and disconnect water supply to the hospital, that is an illegality because you are depriving the community of their right to access quality health care. Okay? So I think leadership must sit up and stop this nonsense. Okay? I have never seen this anywhere. I have practiced in not less than 5 different hospitals, but I've never seen what is happening in Bimbilla before. Okay? So I want to plead and urge the authorities concerned to step in and ensure that this thing never happens. It's most unfortunate. Thank you.
Yeah, Dr.
Thank you, Doc.
Barihama Adam, thank you very much for speaking to us this morning. As you can hear him, he's really passionate about what's going on there, which is most unfortunate. It shouldn't be happening.
Yeah.
No, it shouldn't be happening.
At all. I mean, you can hear his impassioned plea. Just to somebody to listen and see what's happening. We need to decide. You see, part of the problem is that we haven't decided as a country what our priorities are. No, this is part of the problem. This is part of the problem. If we said that our priorities were, yes, there's maternal health or health care in general was a top priority, nobody would have the audacity to go and disconnect water because of non-payment of bills. Yes, we do understand that you need bills to be paid so that you can also run the system. Now, there will be another way around that you will figure out how to get your monies paid, because the hospital there, even though they are the ones who are owing, they are not the ones responsible to pay. Pay, exactly. It's a government facility.
It's a government facility. So then you have to figure out ways of getting your monies paid to you other than shutting down water supply.
Yes. Yes.
Which I'm sure if we were to go into the books, is probably a crime.
Yeah, that's what he was saying. I mean, for an essential amenity like that, there's certain exemptions that have to exist because of the life-saving function that they perform.
Yeah.
And as he said, people have
no, but you know
lost
that
babies
you know that in terms of the human rights, right? Access to health care is a basic human right. So when you don't have water supply to a hospital, you're actually denying access to health care.
Yes. And he said, you've got COVID cases rising, you've got people who are losing babies because of this. And you could hear it in his voice that he's frustrated because nobody seems to care. And it's a shame. And he has to supervise everything going on there with all of this pressure. But, well, we'll keep our eyes on this story. And we thank him for sharing the issue with us and his perspective as well. We'll take a quick break. Breakfast Daily will continue. Don't go anywhere.